Good evening, Los Angeles, and thank you again for joining us for tonight's briefing. And let me just start at a very personal note, because since I addressed you last week, we lost two amazing angels in this city of angels. We seem to live an entire year inside our weeks these days, so forgive me as I go off script just to speak from the heart for a moment. About Tom LaBonge, a council member who I served alongside for many, many years here at City Hall, who embodied this city and service to this city. And Tommy Lasorda, who embodied the grit and the determination and the likability of this city that welcomes you no matter where you come from. Tom and Tommy were the heart and soul of Los Angeles, and we lost them both last week. Dear friends who I knew personally, Tom LaBonge, who we'd run into in Griffith Park holding a football, or maybe on the side of a road picking up a couch and taking it in, helping a senior citizen cross the street, or directing traffic around an accident on the streets. Tommy Lasorda, who'd invite you to sit down in his office and talk about the good old days, what the Dodgers needed to do to win, and maybe even offering you a bottle of wine from his own label. These were two guys who I loved, and two people who contributed immeasurably to our city. I know we lost them, and for so many families out there tonight, you've lost somebody this week. I've talked to too many of you, too many who have lost a son or a daughter, a mother or a father or grandparent. I called one aunt and uncle of a Metro employee who died recently to give my condolences, and spoke to his uncle who raised him. And as I passed on my condolences to his aunt, her husband said she's not here anymore, she just died as well. We carry so much pain in this moment. And I know folks are frustrated and they want it just to end. They want every answer to have every question to have a clear answer, and they want it just to be done. We're seeing everything swirl around us in Washington, the changing of a government come in. But my message to you, like every single time I've shown up here as your mayor, is to give it to you straight. To paraphrase FDR, to give it to you straight from the shoulder, the good and the bad news. And there's three things I want to cover tonight. I want to cover where we're at, as always, what we're doing to help you, and some news around vaccines, which I know can be mind-twisting and bending right now as we try to figure out how those rays of light called the vaccine will lead to a sunny day that will part these clouds and move us finally out of this pandemic. Tonight, let me start with vaccines. And this is a critical moment for all of us as we seek to understand how this will happen, just as at the beginning of this pandemic, we tried to understand what this virus did and how it spread and how we could stop it and how we could stand up testing and what we could do to address disparities and so much more. This is a critical moment, and we've got to get it right. So let me give you an update on all three of those things: the numbers, where we're at, how we're helping people get through this, and the vaccines, because I know it's making a lot of headlines. There's no question that getting a vaccine, as it is right now, twice to every American is the largest logistical undertaking that I've ever seen in my lifetime as an American. And it's happening with a startling lack of clear guidance coming from the Trump administration, and against the backdrop of hundreds of millions of doses that we should have secured and didn't. In the midst of that, there are those of us, your county and state and local officials, who run into that fire. And together with, yes, many good federal folks who are trying to help, figure out how we can make sure that as fast as possible, to the most vulnerable of our people, we can protect them and move our economy forward. So let me try to simplify this, because I think most people are asking three questions: who, what, and where. Who is getting vaccinated in LA County right now? Right now, it's just two groups: healthcare workers, and there's estimated to be almost 1 million healthcare workers in LA County, and seniors who live in skilled nursing facilities. Those who were up to half of the deaths early on, our most vulnerable seniors, many of them who are already by definition sick or with pre-existing conditions or in the most vulnerable age of their life. Those are the two categories right now, folks: our healthcare workers and those seniors living in skilled nursing facilities. What is the next question? What is needed to get a vaccine? Well, simply put, an appointment. And what you'll receive right now, at least until other vaccines that promise potentially one dose, is 2 doses of either a Moderna or Pfizer vaccine. It requires 2 shots. There's a gap between those shots between either 21 or 28 days. And then where? Where will these vaccinations be given? They're either going to happen at public sites, such as ones run by our county, by the city, and other cities around, by your own doctor or healthcare provider, or at a pharmacy. Those are the 3 places that vaccinations are and will continue to be given out. I've been visiting those vaccination sites and trying to do everything I can as the mayor of the city of Los Angeles to assist our county in everything that they are doing to stand up sites by either giving city property to them or in other cases running some of those pods they've asked us and I've talked to you about before to help those healthcare workers, estimated to be as many as 500,000 who still are not vaccinated, to get through as many and any that want that so we can move on to our next tier. I've heard the concerns of people on those sites. I've seen the databases crash as you try to get your first Wi-Fi connection. I've seen the state work hard to improve the technological side, and that will roll out soon. I've seen our county public health nurses administer, and our volunteers from our fire department and CORE, our amazing partner on testing, pivot to an even more complex problem of giving vaccinations out. And I've spoken with Angelenos who are frustrated by the long waits and sometimes the seemingly contradictory information that's out there. We're not just listening to those concerns, we're taking action. And this week I sent a letter advocating for more doses for our cities and local governments without taking a single dose away from our counties like LA County to help us get more vaccines out to more people more quickly. The bottom line is we don't have enough vaccines. And then people point often, well, look how many aren't going out there. It's a dual problem. We need more and we need them to get out more quickly. But one thing we've shown through our testing program is we know how to get the job done, that there are heroes amongst us. I saw those heroes in the city family, firefighters, who've helped stand up the best testing program in America and who are now vaccinating their fellow firefighters and other key folks in our pods who are healthcare workers throughout the county. And I'm excited that together, with the state and answering the call of LA County, we're helping open up, and we will be running tomorrow at Dodger Stadium, a vaccination site that will go live tomorrow and be one of the biggest in the country, if not the biggest in the country. This is a site, as we've seen at Dodger Stadium, that can get people through safely, conveniently, and most importantly, rapidly. And right now, the only people, to reiterate that are eligible for vaccines in LA County right now are healthcare workers and seniors who are living in senior homes and skilled nursing facilities. And let me stop here and just thank the people who are working at those sites. As people get upset that I'm not getting my vaccine or it's not happening quickly enough, I know how hard you are working. I see you. In fact, I've been alongside you. Those nurses, those people working to direct traffic or as logistics specialists, people making sure that we draw the vaccine, people who are counting the doses, and people who are monitoring folks after they get the vaccine to make sure nobody has an adverse reaction. You truly are heroes right now. And you're learning lessons every single day. And I hope everybody out there knows how hard those folks are working inside our hospitals and at these sites. And someone who helped you get a test a month ago might be the very same face you see when it's your turn to get a vaccination at one of these sites. And I want to remind everybody, this vaccine is safe. This vaccine is safe. It's your civic duty when it's your turn to get that vaccine. It's an act of love for your fellow citizen because it's going to save someone's life or many people's life. And it's a forward step to reopening our schools and our economy. I spoke today with President-elect Biden and Vice President-elect Kamala Harris and members of the administration who are focused on the goals of the next 100 days. And I stand ready to help them meet their goals of vaccinating 100 million people in the next 100 days. Los Angeles will help get that job done. There's a long way to go. We're going to have to scale up. But if I've learned anything over the last 10 months, don't bet against LA. Don't bet against the ingenuity and the hard work and the creativity and the inclusion that our problem solvers bring to any job. Tomorrow, we're going to open up our first mass vaccination site at Dodger Stadium with the capacity to inoculate 12,000 people each day. When it's fully up and running, we will see as many as 12,000 people, possibly more, come through there and receive their dose, their first dose, and of course then later their second dose of the vaccination. And we're deploying a whole workforce to administer shots, and doing it all without this clear sense of when vaccines will arrive from the federal government. But we have to take that risk. We have to get it out quick and assume that the next vaccine will be there. America deserves that. Los Angeles deserves nothing less. We're working around the clock to get vaccines to every Angelino, equitably, safely, and soon. But none of this is easy, and we need your help. So please stay informed. I know headlines can sometimes be misleading. What the state is saying, and you're wondering, does that apply to us? A neighboring county who might be at a different phase in their vaccinations because of how many workers they have in the healthcare sector. Educate yourself here of what's happening in LA County. Learn when the vaccine is being offered. Sign up for regular updates from your doctor and your healthcare provider, and from the County Department of Public Health at vaccinatelacounty.com. That's vaccinatelacounty.com. Again, be a good citizen. Angelinos have made sacrifices to help our community get through these moments. They've done a marvelous job at every stage of this crisis, so let's keep that up. Don't try to cut the line. Don't try to make a deal. Please be patient and know that the vaccine will come. And finally, when it is your turn to get vaccinated, get vaccinated. It is safe and effective. You'll need to make an appointment and bring your ID when your time comes. And remember, there's 2 doses as of right now in all the vaccines that are permitted to get fully protected. And make sure that your family and friends get their shots too. This is our civic duty, our responsibility to one another, and our way out of this pandemic. As our public health partners work around the clock to get vaccines into arms, and our doctors and nurses fight this virus in our hospitals, we'll also soon be getting some badly needed relief from the federal government. One additional thing I spoke to the president-elect about today was his American Rescue Plan, $1.9 trillion that he's introducing and that we hope Congress will swiftly approve to give the assistance to Americans that we need to accelerate our way out of this pandemic and to stand up our economy, to build back better in the United States of America. Tonight, I joined mayors from across the country discussing the details of this bill, and Congress needs to get this relief passed immediately. It includes utility assistance and rental assistance that builds on the successful programs that we had right here in Los Angeles and continue to have. It has aid for everything from childcare, for the unemployed. It increases that payment, yes, finally, from $600 to the full $2,000 by adding $1,400 to families that are barely scraping by. Assistance for our businesses, assistance for our transit systems, and yes, finally, for local and state governments that are on the front lines. It does it with equity, looking at those communities of color who have been hardest hit, ensuring that our federally qualified healthcare centers can get vaccines out where we're having outbreaks. It does everything right, but we need that money to come swiftly, and we need it to come strongly. If we learned anything from 2009 and the Great Recession, is Congress and the administration then didn't go big enough, and it didn't come fast enough. This finally is the size that we need, and I hope they will give us the speed that America demands. On so many levels, the desperate calls of families are being answered with this package. And we know that when we get this passed, we can help stand up our economy that much quicker. We can get vaccines to people that much more swiftly. This is the leadership we need, and I enthusiastically support President-elect Biden and Vice President Harris's effort in this critical undertaking. As of today, let's run through the numbers. As of today, 1 in 3 people in LA County, it's estimated, have been infected by the virus. 1 in 3. That's more than 3 million of our neighbors and friends. As of January 12th, there were 544 open or active outbreaks in non-residential locations in Los Angeles, places like warehouses and shops, offices, delivery centers, police stations, fire station, and at LAX. Our numbers remain very high. We remain one of the epicenters of this disease across the country. But they are, luckily, numbers not now at record levels. Remember, our test positivity rate was cresting up past 25% at our city testing facilities. Right now, it's 18.9% countywide and down to 20.4% at our city testing facilities, a drop of about 20%. That's a good sign. But I'll tell you how that number goes right back up if we don't stay vigilant, if we don't keep wearing our masks, if we don't make sure that we're continuing our distancing, don't mix households, and do all the things that we know can control this virus. We had 17,323 new infections today in LA County, still a huge number, an 18% increase just since yesterday. And of those, nearly 8,000 were in the city of Los Angeles, 7,912. 1,677 patients are severely sick in our intensive care units, 1.5 times higher than last month. And I spoke with executives in a number of our hospitals today, and they said, while they're breathing a little bit easier today than they were yesterday and the day before, they're still exhausted and being worked to the bones. There are some hopeful signs that the interventions that you are leading, our actions, right now aren't seeing a massive spike from Christmas and New Year's, but it's too early to know for sure. We're beginning to see some of that potentially work. 7,715 people are now hospitalized for COVID-19, a 2% decrease since yesterday. Again, not big, but when's the last time you heard me talk about a decrease in hospitalizations at all? We see early signs that hospitalizations may be stabilizing, but I remind people, this plateau, if it is a plateau, is too high to sustain long term. But we aren't even close to being out of the woods. Every one of these numbers is devastatingly high, and we know that case count results in hospitalizations, and those hospitalizations will result in too many deaths. This is the moment for us to double down, to take to heart what I've been saying, that we're all doing so much, but we can each always do a little bit more, and to stretch, to push down this curve, just as we did last year, to make sure that we're staying home and washing our hands, avoiding every kind of gathering, tightening our bubble. And if you can work at home right now, you should work at home. If your employer, and by the way, your employer is obligated to support you in that. If your employer isn't allowing you to work from home, please let us know. And even once you've been vaccinated, you need to keep taking the precautions because you can still spread. The vaccine prevents disease, but we don't know for sure whether or not it cuts off your ability to spread. So wear your mask even after vaccination. If you have COVID symptoms or think you might have been exposed, get tested immediately and quarantine until you've received back a negative result. And if your test result comes back positive, isolate yourself for at least 10 days from the time your symptoms first appeared and stay isolated for at least 24 hours after your last fever. As of this week, we've conducted 3.66 million tests at city sites since the start of this pandemic. This week, we're conducting up to 28,000 tests a day. And now that we are transitioning the Dodger Stadium site and the VA to vaccination megasites at Dodger Stadium, we're working to rapidly expand testing capacity at other sites across the city. We've added 2,000 spaces in our mobile teams that are out there, and mobile clinics, that we're bringing to you. And so far, it's holding. Testing appointments are available currently for tomorrow and Saturday. And as always, our 5 walk-up sites and pop-up sites will take folks with or without an appointment. To find out the locations of those mobile teams or any of our testing sites and pharmacies and other places throughout our city and county, please go to coronavirus.lacity.org/testing or call 311. Finally, during all of this, we've tried to help one another, especially those areas and those people who have been toughest hit by this pandemic. The Grocery Initiative for Vital Emergency Needs, or GIVEN, was created to support those struggling Angelenos with a little bit of help to make sure that they could buy groceries, feed their family, pay their bills. And thanks to an anonymous donation of $3 million, the Mayor's Fund for Los Angeles was able to fully fund this program and meet its goal of helping 10,000 more local families. And even in this season of suffering, Angelenos have gone above and beyond the call of service. With 1,280 donors to the Mayor's Fund in December alone, thank you to each one of you, whether you stretched to give $5 or whether you stretched to give $1 million. We didn't just meet our goal, we exceeded it, and we need to keep it going until that federal aid arrives. We expanded the GIVEN initiative by more than 25%, helping 12,572 families. And Given built on our series of relief efforts, our workers, our households, and especially our city's small businesses. Early on, we set aside a portion of our CARES Act allocation to help those small businesses that are the lifeblood of LA. I'm the grandson of two small businessmen, one who was a barber and one who was a tailor. I remember my first jobs were working for my grandfathers, sweeping up hair at the barber shop, helping sell ties in my grandfather's clothing shop. We know that this is what keeps communities stabilized. We know what this is doing to provide opportunity and build wealth, but we also know what's on the line. Communities shattered, fortunes lost, and jobs that disappear when a business goes away. The grants we were able to give were the difference between folding up and pushing through. But without federal assistance, these funds have dried up, and the wait list has grown longer and longer. And for the most vulnerable businesses, they never got access to PPP and other things that require on having a great relationship at one of the bigger banks. This is a city of angels, though, and so we have stepped up. And tonight, thanks to an incredibly generous donation of $5 million from Willow Bay and Bob Iger, I'm proud to announce that 1,000 of our city's hardest hit businesses will come off that waiting list and be helped now to be able to bridge this moment, to survive, and soon, yes, to thrive once again. Thank you, Willow and Bob and your entire family, for your generosity of realizing the importance of small businesses and standing up help for 1,000 businesses in every neighborhood of LA. After you guys gave $500,000 to the Mayor's Fund early in the crisis, your new commitment will help these businesses weather this storm, and we are beyond grateful for your bold leadership. No matter who you are, no matter how much you have, you can make a difference as well. Please go to mayorsfundla.org and give anything you can to help those workers and those families and those businesses struggling. There's beginning to be the light at the end of the tunnel, but right now we're still stuck in that darkness. Help is on the way. Los Angeles, this has been a bitter winter, and we're not through it yet. It's a challenging chapter, a confusing moment, and it's been capping off 4 long and difficult years where our city has seemed to be the target of Washington, D.C. But hope is on the horizon, and change is coming, and strength sleeps, hibernates, like an animal waiting for the frost to melt, and for hope to rise up like a flower out of that. And this is our moment for all of us to see that and to do what's right, to double down, to wait our turn, to make sure we're helping, to be vigilant, and to see a Los Angeles and a nation that will rise once again. So keep being there for each other, and keep making sacrifices, and keep staying safe, and staying healthy, and staying home. Strength and love, Los Angeles. We're going to get through this. And with that, I'm happy to answer questions.
Thank you. And our first question comes from Maya Lau from the Los Angeles Times. Please go ahead.
Good evening, Maya.
Hi, good evening. The switch of Dodger Stadium from being a testing site to a vaccination site was sudden and came as a surprise to people working at the city's test sites. Whose idea and whose decision was it to switch Dodger Stadium to being a vaccination-only site? Sure. Was this an initiative from you, from the governor's office, or someone else? And I also want to know, what does this mean in terms of the total number of daily COVID-19 tests available to Angelenos?
Yep.
Is the same number of tests that were being given at Dodger Stadium still being given, just at different sites?
Absolutely. Thank you, Maya. Let me work backwards. Our tests are meeting up with the need. They were reduced from a capacity of a little bit over 40,000 to now about 27,000. But the reality is, every day we had about a 20% drop-off rate. So the proof is in the pudding of looking at, are there tests available? And right now, tests are available. And that's not because we've throttled the number or made it tougher, both with symptoms and without symptoms. We saw that demand, which we've ramped up when we've needed to ramp it up, begin to also fall off. Another good sign, by the way. The first sign you get is how many people are testing. The second is how many cases you get. The third is how many are hospitalized. The fourth is the worst one, how many people we've lost. So we are meeting that. We've added 2,000 more with our mobile testing. In the Valley at Pierce College, we'll add another 2,000 shortly. And then we're looking at hybrid sites to be able to do testing and vaccinations at some future sites. So stand by for those. We're looking at where that can both be done together and where it's best to do as well. In terms of the idea, this was really on the advice of our fire department and our core partners of where was the best site to be able to do a mass vaccination center. And it was clear we didn't have enough personnel to do both on Dodger Stadium, the testing and the vaccinations. In fact, we also closed down, as you know, the VA testing site because we needed personnel from 2 testing sites just to match what we need for vaccinations in one. But that said, we're building what we think is one of the biggest, if not the biggest, vaccination sites in the country. It was responding when county came to us and said, hey, will you be willing to build on what we're doing together at the smaller pods and parks and places and do a big one? And so we kind of did what our firefighters lead us to always do. Our firefighters, it was really LAFD who put together the logistics, planned that, have the lessons of 10 months, and said this is the right place to do it. So tomorrow we'll open that, work it on tomorrow and Saturday, and hopefully by next week we'll be at full capacity there. Any follow-ups on that? Did that answer the question?
Yes, thanks so much.
Okay, thanks, Maya. Next question, please.
Thank you, and that comes from Claudia Pashuta from KNX News Radio. Please go ahead.
Hey, Claudia.
Eric, I have a couple of questions.
Sure.
So when you say there isn't enough vaccine and also that it's not being used up quickly enough, what do you think is the core issue? Is it staffing? Is it a logistical issue? Did planning for the rollout of the vaccines, which we knew were coming, fall short? Second question. Such a high test positivity rate suggests that a lot of cases are still being missed. Does that mean that more needs to be done to increase testing capacity and encourage more people to get tested? Should there be surveillance testing at places like large chain retail stores? And then with the threat of the UK strain, coming to LA County and revving up the spread here, do you think tougher restrictions might be needed? Thank you.
Okay, I think I heard the third one, but I definitely got the first two. So it's complicated as the answer to the first one. There's a lot of reasons. I think the first part of it is this is something new, and I've never seen something new work on day one. But we better make it work as quickly as possible collectively. So in terms of the vaccines, I think a lot of it is retained by hospitals and healthcare providers for the second dose for their workers. There's a reason healthcare workers go first. They're the most at risk, and they're also the ones that are most risky to us, together with those seniors who are the most at risk. And as I mentioned, we're about half of the deaths early on in skilled nursing facilities, senior homes. So those two places, I think, are reserving some of that. So people say, why isn't it just going out there? That's an allocation. Just to remind folks, I don't allocate a single vaccine, but the allocations that go out then are allowed to be kept by those providers to meet their needs. But I do think those numbers will come way down and come down quite quickly as we see these mass centers, and the county beautifully is setting up 5 as well. So Dodger Stadium may be the biggest of those, but there's 5, 1 in each of the supervisorial districts that's also going to be there. Combined, we're going to see, tens of thousands every week, maybe even hundreds of thousands of vaccines just from those mass sites. So I don't believe that it was, by the way, when you don't have enough supply in, to that point, it's difficult to plan for. And one of the things that I told the president-elect is, please give us as much predictability, because we can ramp things up if we know it's coming. But if it's not coming, the worst thing is somebody not to get that second dose when it's time for him or her to get it. Second, in terms of the high positivity rate, while we can't force people to get tests, you've probably, unfortunately, had to listen to me in every single one of these briefings, and I've never not only not discouraged, but I always strongly encourage people to get testing. And we haven't dialed that back one bit, and we have open testing. So we always try to hit that sweet spot of meeting the need when that ramps up. I think you remember there was a week or two when we did have a 6 or 7 day delay, but that's like 1 or 2 weeks out of the 10 months we've gone through this. So we've been able to ramp it up. And at times like this, when we see some of the desire to get tested go down, I would encourage anybody with symptoms, please, please, please get tested. Anybody who believes they've been exposed, please, please get tested. There's probably been a population on top of that are folks who are kind of the worried well, that we call them, or folks who have used it, as I said, in a way that shouldn't be used as a passport to party or to see friends or to travel. That's not what those tests are for. So as long as we still have open appointments, that's always, to me, the metric of, are we doing it right? Are we going the right way? In terms of surveillance testing, sure, and I know public health does some of that. Whether you do that at a big box store or whatever, if you did a PCR test, that's not going to tell you about whether you're getting infected there, if that's the reason to do it. But you'd have to have somebody, and the city certainly doesn't have those tests, to do rapid tests. I think right now, the strongest testing program in the country remains the strongest testing program in the country here in Los Angeles, free of charge to anybody with or without symptoms, a quick turnaround, and with appointments available. And the third, given the UK variant, thank you to Alex, who you've seen spraying before, our great assistant who is here, who's writing these questions down so I don't lose them. Given that the UK variant, of course, we have to always be open, and I will always follow the science and the advice of our public health and Dr. Frere and others in terms of, and the county supervisors, who I know are making very difficult positions and are incredible leaders right now trying to figure out whether or not there should be further closures. So, if there are further closures that are coming, that is something that would be the result of if we see another outbreak because of variants like the UK variant. So if necessary, I've been pretty consistent, 100% consistent. I absolutely do support those measures. But we don't have a lot of evidence yet of the spread of that. Thank you, Claudia. Next question.
Thank you. And that comes from Hetty Chang from NBC Channel 4. Please go ahead.
Good evening.
Hey, Mayor, thanks for taking our questions. I have a few. Are people who are getting vaccinated at Dodger Stadium tomorrow already registered, and can people register now? And also, once we move on to these next groups of eligible people for the vaccinations, especially older folks who aren't necessarily tied to an employer, who's going to let them know it's now your turn? We've heard that the state is launching a website next week. Is that going to come from the state? Should they rely on the county, the city, or perhaps their physician?
Yeah.
And then thirdly, there was a story this week about a clinic which was left with about 150 unused vaccines because people just didn't show up. And instead of throwing them away, they allegedly gave them to non-priority people. My question is there a directive to throw away unused vials, into the trash? And if so, why not get those, vaccines into the arms of people who may not be, priority people instead of just throwing it away?
Great. Let me work backwards. 100% I agree with that. And while I don't put that guidance out because we don't have a health department, that comes from the county and from the state, I think everybody recognizes that at all levels. I'm sure that our governor, I'm sure our supervisors, certainly I, don't want to see a single dose wasted. And part of that, when you stand up new sites, you don't know how many people are going to show up. So there is no directive I've ever heard of that it should be thrown away if it's not going to somebody who's not in that first tier. And absolutely, we should be getting that in the arm of anybody. And I'll confess, at a city site where we had a little bit extra one day, we didn't want to waste that. So we told the local police station, send over a few people and get it in the arm of police officers because they're going to be next. Absolutely. We need to use common sense. We need to have some flexibility, and we need to make sure that it's getting it into people, that we can never waste a single dose. Second, in terms of how will people know it's their turn, it's a great question. I think probably the core question for most people are willing to wait. They just want to know when. The state technology change that's coming, I think, will go a long way. It's, as I understand, built by Salesforce.com, used in other states. That's a California company. And they're going to be able to have us register throughout the state and then get the announcements when our county changes who is eligible to get a vaccine. A lot of people will get it through their healthcare provider as we go through this next 6 to 7 months of this vaccination process. Some of it early on, we're rushing through county, city sites, hospitals and providers to do that at people's place of work, or for healthcare workers to say, look, bring your ID, register, and you can get in at these sites. But long term, I think many of us will get that notification at Kaiser, at your hospital. Now, people who fit into this category are eligible, come on in. And in fact, we need that to happen. We need our pharmacies, we need our healthcare system to step up aggressively. This is one of the things I talked to the president-elect and the incoming members of the administration about, was really holding everybody's feet to the fire, because it's not singularly the responsibility of government. We have an amazing healthcare system that can rise to this occasion, and pharmacies that are in neighborhoods that can be a part of this as well. And I know that will start soon. So the system that exists right now, I think everybody saw those shortcomings. It's a quick turnaround of a new system, and the information of whom is all in the same place, which I think will answer your first question, vaccinatelacounty.com. Yes, at Dodger Stadium, you need an appointment. We're still abiding by the county-established regulations that the city site that we're running is for healthcare workers until healthcare workers, the most vulnerable, are done. At the same time, city folks are going proactively with vaccines provided by the county into our skilled nursing facilities. So seniors are receiving, but only if they live there, and you can't make that an appointment. That's something where we're going to those homes and making sure those most vulnerable are taken care of. So Dodger Stadium will help us hopefully get through that backlog even more quickly of our healthcare workers. It's not really a backlog. I know one of the headlines I saw today was about delays for seniors. Let's be clear. The governor has been clear. He said that counties who are done with healthcare workers can move to more seniors getting this. But that doesn't mean every county will. And our county is not done. It's tough. Before everybody piles on everybody, let me just defend the county and the state. The county has been clear what our top priority is, which is our healthcare workers. Because if they're not there, or they're out, or worse, they're dead, they're not there to help us, and they are at most at risk of spreading. Second, though, if you're governor, you have very diverse counties. And so there may be counties that are small, ready to move forward, and can do that and expand that because they've finished their healthcare workers. Those aren't mutually exclusive. But there hasn't been a delay. I think the county's been very clear that it would take during this month to get those healthcare workers done. Anything we can do as a city to assist and to accelerate, we're ready, willing, and able. Thank you. Next question.
Thank you, and that comes from Ron Lynn from the Los Angeles Times.
Hey,
Please
Ron.
go ahead.
Hey, Mr. Mayor, thanks so much for taking our questions. We really appreciate it. Two questions for you today. To follow up on Claudia's question about the idea of new health order restrictions, do you know what's being considered, and do you think it should be implemented regionally through the state framework and not just with LA County? And number two, given how there's a lot of people who are still defying pleas to stay home and wear masks, there's been some concern that people are just tuning out the warnings about the pandemic, and some wonder whether the public messaging has been either too dire or too optimistic, and there's been some criticism for messages being contradictory. Do you think there are ways LA City or LA County can improve its messaging? Thanks so much.
Sure. I think you hit a really good point in your second question, which is, and what I always try to do, is saying, hey, here's the encouraging news, but it's still really bad. Don't rest on your laurels. Don't get cocky. Don't get lazy. Don't think that you can just be exhausted. That's when the virus preys on us and somebody you know and love will die. So I do want to point out when things aren't accelerating. I don't want to scare people with false. I'm always trying to be a straight shooter. So like tonight when we say hospitalizations went down for the first time a little bit, that's important news because it should be the reward and prove maybe counter to the implication of the first part of the question that people aren't listening and they aren't doing the right thing. People are listening and are doing the right thing. We just need to do it even more, and we need even more people to do it. We can always find the people that are exceptions. We can always find the moments when people didn't do 100%, and we'll never get to 100%, but the goal should be as close to 100% as possible. In terms of the orders, that's something I know that the county is looking at. I think it's the obvious categories of things that people have looked at, whether or not schools stay open and closed, whether outdoor gyms and recreational youth leagues stay open and close, indoor malls, retail, things like that. I have been very consistent that I will support what public health recommends and our public health professionals recommend. We know most of the outbreak is not necessarily happening in what's open and closed. It's happening now in homes. We reached that breaking point where too many essential workers in our denser neighborhoods have to go to work or coming home, and we're spreading that. Which is why it's so critical for us to, I hope, also focus vaccines not just on age groups, but on the geography of where the outbreaks are happening as soon as we get more vaccines and have that flexibility. That's something Dr. Ferrer and I talked about, and that she kind of inspired me to think about. But wouldn't we want to go into a place where there's 5 or 6 times higher spread and try to make sure that we're accelerating vaccines where people are dying, where people are getting sick in those dense areas? In the meantime, let's follow this closely. If things continue to come down a little bit or come down even more quickly, maybe more closures aren't necessary. But the moment it goes up, like we saw in December, at any pace like that, absolutely. That is something we cannot sustain, and most importantly, our hospitals cannot, and we would move into crisis mode there. Thanks, Ron. And next question, please.
Thank you, and that comes from John Rigardi from the Los Angeles Magazine. Please go ahead.
Hey, John.
Hey, hello, Mayor. Thank you so much for taking the call. A question about city finances. In the past 2 days, you have announced agreements with public employee unions to defer raises as part of an effort to shore up the economy. However, we know that revenues in the city are down significantly, and they're not going to recover for months. What kind of impacts are average Angelinos going to see from this financial situation? Are we going to see fewer trees trimmed, roads paved, cutbacks in police patrols, as Chief Moore has warned, or something else? And sort of tied to that, could some of these impacts on average Angelinos be averted if police also agree to defer raises?
Absolutely. First of all, this has to be shared by everybody. And one of the things I've been really moved by is our amazing city workforce, whether they wear a badge or whether they don't, whether they work in the libraries or Department of Water and Power, police, fire department, folks who are public works professionals. You know, I've gone through a lot of negotiations in my time, and let me thank those union leaders and the people they represent for understanding this is the toughest economic and thus fiscal year of our lives, and who stood up to say, maybe now is not the best time to take that raise if we can protect the services of the people who we serve. So we've done that, as you read and heard about with our civilian unions, nearly 100%, and hopefully soon 100% of them. And today we announced with our firefighters. And when it comes to police, I would say the same thing. Of course, this is all of us. I'm not taking that raise, none of us. And everybody has had a cut, by the way. So to your first part of the question, where will you feel it? There are certain areas we obviously will protect. We're going to protect some of the core things so that when there's a 911 call, there's a fire engine and patrols aren't going to be cut, even as we have to in fire and police and public works. Put certain things off, whether it's buying computers or some projects that will take now 2 or 3 years to build instead of 1 or 2. That's what we have to do. The bulk of how we're doing this luckily comes from what we've done collectively. And I want to thank the City Council and our City Council President and Budget Chair. We've squirreled away together a lot of money in the reserve funds. We're going to spend 100% out of our emergency reserve fund, but that will help us not have to make as deep cuts. We're going to take the financing of our projects out a couple of years so that we'll pay that off over a longer period of time for the public works projects and improvements for traffics and sidewalks and tree trimming. But one thing I said, that unlike 2009, we're not going to stop doing those things. We won't have brownouts in our fire stations. We're not going to have tree trimming come to a complete halt and go to zero. We're going to trim and share this together, and that's my message for everybody. To thank our police officers, thank our firefighters, thank our civilians who serve us every single day, and know that nobody is unequally being asked of anything. And yes, absolutely, we hope everybody will share in that sacrifice. It only works if we work together. Thanks, John.
Thank you, Mayor.
Next question, please.
Thank you, and that's from Ed Lascaux from Fox 11 News. Please
Hey,
go
Ed.
ahead.
Good evening.
Hi, Mr. Mayor. How are you, sir?
We're hanging in there. Thanks.
Wanted to follow up, if I could, please, on an earlier question. Reports about the health clinics actually throwing away good vials of the vaccine. The question is, do you think that there should be some actions, a punitive action taken against anyone who would throw away trash, what you earlier called rays of light? Also, do you think there should be perhaps better guidance from county health as to what to do at the end of the day with the unused vials? To their credit, a lot of the clinics say that they've been given strict orders. If you're not a member of the 2 categories cleared to get the vaccine, then no vaccine for you. Your thoughts, sir?
Yeah, I think we need flexibility, and I think that people are beginning to understand that. In the conversations I've had, there is increasing flexibility. Not so much of saying, hey, anybody can come here, but if you didn't get it right and there's a couple doses left at the end of the day, of course, put that in the arm of somebody rather than throwing that out. I don't know that I'd start by punishing people. I'd just make it easier for them to be a part of the solution and be able to put it into somebody else's arms. I think that's a better way first, because I don't think there's a conspiracy that certain people are consciously saying, hey, I want to throw this out. They believe that they might have had to. But those are going to be far, I hope, and few between. I know in the first couple days in sites I visited, there was some excess left, and I said, hey, you who's a frontline worker, get it, and you who's a frontline worker, might have been the Rec and Parks staff member. They're right there, essentially acting as a healthcare worker. Get that so it's not wasted. And I hope others will continue to use that common sense, and hopefully we'll get that sort of guidance as well to allow that to happen without it becoming a slippery slope of suddenly anybody can come in and those sites being overwhelmed before we take care of the healthcare workers, take care of those critical seniors that are living in our skilled nursing facilities. And we get through that, there's another tier coming soon. Thank you. Next question, please.
Thank you. And our final two questions tonight are in Spanish. And our first question comes from Victor Cordero from Estrella. Please go ahead.
Hola, Victor. Buenas tardes. Are you there?
Yes, can you hear me?
Yeah, I can hear you. Great. Thank you.
Hello, can you hear me? Can you hear me? 1, 2, 3.
Yes, we can hear you.
Hello, Alcalde, buenas tardes. Víctor Cordero, de Canal 62. I'm going to ask my questions in English, and hopefully you can respond them in Spanish. Sorry, but I got a couple of questions. Number one is that you mentioned that Angelinos are doing the right thing, staying at home. There are some that say, arguably, that it would be wiser to vaccinate the people that go out to work. Gardeners, bank tellers, cooks, people in restaurants, office staff, people that are not considered first responders. So why is that something that we should do or not? And question number 2, many people have not been able to pay the rent. You have helped them for almost a year saying that there should be no evictions. But let's talk about the utilities, gas, power, water. The county is not charging late fees nor making disconnections. But what's going to happen when the utility companies start collecting the debt? People are not going to be able to pay those big amounts. Are you going to start making disconnections, or are we going to let it slide? What's going to happen? Gracias, alcalde.
Por supuesto. I'll answer them in English and then in Spanish, and then I'll go, as always, to my Spanish remarks. So first, let me answer the second question. Absolutely. I'm in favor of, and we're helping do that at our Department of Water and Power, utility assistance, payment plans over a long period of time, and then direct assistance for utilities to help people just pay their bills off altogether. One nice thing about the package that we saw come forward from President Biden is that there are tens of billions of dollars, I believe in it. I have to look at the exact number for utility relief inside this bill. So if I might be off by a little bit, but at least 10 billion, maybe $25 billion of utility assistance. And yes, that should help us get through this together with increasing the direct payment that people will get should be enough to make sure. And we have suspended all cutoffs, so nobody will have their power, their water cut off during this pandemic as a result of not being able to pay. En español, sí, yo apoyo esta ayuda y hay fondos en esta propuesta del presidente elegido Biden para asistir con los utilidades, específicamente con la electricidad y el agua, y también en todas partes del país. Este es importante aquí en Los Ángeles, a nuestro departamento de electricidad y agua. Tenemos programas a asistir y no hay la cesación de estas cosas durante esta pandemia. No es justo y continuaremos a proteger su electricidad y su agua durante esta pandemia. Second one, should we be vaccinating critical workers faster? All of this is a math question. We can't add new people until there's more vaccines. So we need more vaccines, we need more vaccines, we need more vaccines. I still support and believe that our healthcare workers need to be vaccinated. At least everybody who wants one, hopefully all of them will. The moment that there's not demand there, yes, shift quickly to the next phase, whether that's seniors, people living in vulnerable neighborhoods, and or critical workers. That's going to be very, very important. I think by looking at geography, we could capture many of those critical workers. Northeast San Fernando Valley, Boyle Heights, South Los Angeles, where we're seeing the highest number of cases. As soon as we have the flexibility from the state, absolutely, I would support the county going into those areas, and I think we would catch those essential workers who are going to the grocery store, who are working in those line jobs. You know, gardeners, maybe they're more outdoors and less at risk of spread, but people in factories, people who are in grocery stores, people obviously, as we've said, who work in hospitals, they need to continue to be at the front of the line. Sí, yo apoyo más vacunas por los trabajadores esenciales, especialmente en nuestros supermercados, en las fábricas y otros lugares donde hay un riesgo muy alto de la infección de COVID-19. Este es importante, pero necesitamos más vacunas. Solamente es matemáticas. Si no hay suficientes vacunas, no hay la oportunidad a dar más rápido estas vacunas a nuestra gente. Pero especialmente en nuestra comunidad, no tengan miedo, esta es segura. Y al fin de este mes, los trabajadores médicos probablemente cuando ellos han recibido sus vacunas, hay más oportunidades por estos trabajadores, por las personas de tercera edad. Y la ciudad de Los Ángeles está aquí para asistir al condado y estado a distribuir estas vacunas en sitios como el estadio de Dodgers. Gracias. Oh, there's one more question that just came through. Go ahead.
Thank you, and that comes from the line of Edith Granero from Univision. Please go ahead.
Hola, Edith.
Hi, buenas tardes, alcalde. ¿Cómo está?
Buenas tardes, muy bien.
Mi pregunta es, ¿la ciudad de Los Ángeles tendrá su propio plan de implementación de la vacuna o seguirá el plan del condado de Los Ángeles? Y la segunda parte sería si el proceso de la vacuna estará abierto a todos los residentes de 65 años o mayor de otros condados también, o cómo será la verificación de residencia.
Sí. Claro, gracias por la pregunta. Primero, hay una opción en condados donde toda la gente que están trabajadores médicos, donde sus programas pueden expandir a otras personas de tercera edad, personas que están trabajadores esenciales, pero ahora el condado de Los Ángeles no ha completado las vacunas por los trabajadores médicos. Probablemente por el fin de este mes, esta apertura abrirá más por otros trabajadores. El mensaje del gobernador Newsom es claro, en condados donde la vacuna es con todos los trabajadores médicos, usted puede mover al próximo grupo de trabajadores, pero no en Los Ángeles a esta semana, pero probablemente en 2 o 3 semanas. Segundo, la ciudad debe usar el plan del condado. No tenemos la autoridad, tenemos otros guías, otras regulaciones para la vacuna. La autoridad es una autoridad del estado y condado, pero yo apoyo el condado con esto. Es muy difícil. Es difícil decir no a otros grupos de personas que quieren una vacuna, pero los trabajadores médicos tienen el riesgo más alto de infección y para infectar a nosotros también. Por eso es importante finalmente tener una aceleración de sus vacunas y la ciudad es una pareja a asistir al condado con sitios como el estadio de Dodgers para acelerar la vacuna. And I'll probably say some of that again in Spanish here too. Thank you, everybody who's been listening in English, and I'll transfer over to Spanish. Gracias a todos los miembros de la prensa. Thank you to all the members of the press, and we'll see you soon if you're tuning out. Muy buenas noches, Los Ángeles. Hoy quisiera hablar sobre la vacuna. Este es un momento crítico y debemos hacerlo bien. No hay duda de que este es el mayor esfuerzo logístico de nuestra nación y está sucediendo sin un plan del gobierno federal bajo la administración de Trump. ¿Quién se está vacunando en el condado de Los Ángeles ahora mismo? Los trabajadores de salud. Las personas mayores en hogares especializados ahora son elegibles. Y estamos llevando las vacunas a donde viven y trabajan. Esta será una vacuna Moderna o Pfizer que requiere 2 inyecciones y las vacunaciones se darán en sitios públicos, una clínica o una farmacia. 3 lugares. He estado visitando lugares de vacunación y hablando con enfermeras, médicos y administradores de salud. Y he hablado con angelinos que están frustrados con la larga espera. Y estamos tomando medidas. Asistir a nuestras parejas a nivel condado y estatal. Y esta semana envié una carta abogando por más dosis para nuestras ciudades sin quitar ni una sola dosis a los condados. Una cosa que hemos demostrado a través de nuestro programa de pruebas es que podemos hacer el trabajo. Y estoy entusiasmado junto con líderes del estado y del condado de abrir el estadio de los Dodgers a las vacunas mañana. En este momento, las únicas personas elegibles para vacunarse en el condado de Los Ángeles son los trabajadores de la salud y personas de tercera edad en hogares con cuidado especializado. Les recuerdo que esta vacuna es segura, no tengan miedo. Es su deber cívico, es un acto de amor y es un paso adelante para reabrir la economía y nuestras escuelas. Hablé hoy con el presidente electo Biden y la vicepresidenta electa Harris y miembros de la administración, y estoy listo para ayudarles a cumplir su objetivo de vacunar a 100 millones de personas en las primeras 100 días de su administración. Los Ángeles ayudará a cumplir este trabajo. Nos falta mucho, pero lo lograremos. Mañana abriremos nuestro primer sitio de vacunación masiva en el estadio de los Dodgers, con capacidad para vacunar a 12,000 personas al día. Uno de los sitios, tal vez el sitio más grande en este país. Estamos desplegando toda una fuerza laboral para administrar las vacunas y haciéndolo todo, a veces sin saber cuándo ni cuántas recibiremos. Estamos trabajando día y noche para poder vacunar a todos los angelinos de manera equitativa, segura y rápida. Todo esto no es fácil y necesitamos su ayuda. Así que primero, infórmese sobre dónde y cuándo se ofrece la vacuna con su médico y el Departamento de Salud Pública del condado. Visite vaccinatelacounty.com. Segundo, sea un buen ciudadano. No intente cortar la línea ni pagar para vacunarse. Por favor, tengan paciencia y sepan que la vacuna llegará. Finalmente, cuando sea su turno de vacunarse, vacúnese. La vacuna es segura y efectiva. Y asegúrese de que su familia y sus amigos también lo hagan. Mientras nuestros socios de salud pública trabajan para seguir vacunando y nuestros doctores y enfermeras luchan contra este virus en nuestros hospitales, pronto llegará alivio federal. Una cosa adicional de la que hablé con el presidente electo fue el plan de rescate americano. Y esta noche me uní a los alcaldes de todo el país discutiendo este proyecto de ley. Y el Congreso necesita aprobar este alivio inmediatamente. Hay asistencia para servicios públicos y asistencia para el alquiler. Nosotros ofrecimos estas cosas en la ciudad antes de que fueran incluidos en cualquier modelo de asistencia federal. Y estamos contentos de que ahora sean adoptados nacionalmente. Este es el liderazgo que necesitamos y que merecemos. Y apoyo al presidente electo Biden y a la vicepresidenta electa Harris en este trabajo crítico. Ayuda por los trabajadores, por las madres y los padres, por los dueños, por los negocios en nuestros vecindarios. Todos merecen esta ayuda y finalmente están viniendo. Hasta hoy, 1 de cada 3 personas en el condado de Los Ángeles ha sido infectada por este virus. Más de 3 millones de nuestros vecinos y nuestros amigos. Al 12 de enero, habían brotes activos en 544 lugares no residenciales en Los Ángeles. Nuestra tasa de positividad en las pruebas del condado es del 18.9%, un poco de reducción en este nivel. Estas es buenas noticias para usted, para todos nosotros. Tuvimos 17,323 nuevas infecciones hoy en el condado de Los Ángeles, un 18% de aumento desde ayer. 7,912 de nuevos casos están en la ciudad y 1,677 pacientes están en nuestras unidades de cuidados intensivos. Hoy, tristemente, hubo 130 muertes en la ciudad de Los Ángeles y un total de 287 en el condado. Vemos señales de que sus acciones han empezado a tener impacto. Vemos que las hospitalizaciones pueden estar estabilizándose, pero tenemos que seguir nuestros esfuerzos para progresar. Este es el momento de duplicar las medidas para parar la propagación. Quédese en casa cuando pueda. Lávese las manos. Use una mascarilla y evite reuniones. Si puede trabajar desde su casa, hágalo. Y su empleador está obligado a ayudarle con eso. Si su empleador no le está permitiendo trabajar desde casa, comuníquese con nosotros. Incluso cuando esté vacunado, hay que seguir tomando estas precauciones, porque aunque la vacuna previene la enfermedad, todavía no sabemos si previene la propagación. Si tiene síntomas de COVID o cree que puede haber estado expuesto, hágase la prueba inmediatamente y póngase en cuarentena hasta que reciba un resultado negativo. Si el resultado de la prueba es positivo, manténgase aislado durante al menos 10 días desde que aparecieron sus síntomas y permanezca aislado durante al menos 24 horas después de la última fiebre. Hasta esta semana hemos realizado 3.66 millones de pruebas en sitios de la ciudad desde el comienzo de esta pandemia. Esta semana estamos realizando hasta 28,000 pruebas al día y estamos trabajando para ampliar rápidamente la capacidad de pruebas en otros sitios de la ciudad. Las citas para las pruebas están disponibles mañana y el sábado. Y como siempre, nuestros 5 sitios de visita y 5 sitios móviles no requieren cita. Pero encontrar dónde pueden hacerse la prueba, visite coronavirus.lacity.org/testing o llame 311. Durante esta crisis hemos hecho todo lo posible para ayudar a nuestros vecinos más afectados. Y esta noche puedo compartir que gracias a la generosidad de angelinos, logramos expandir la iniciativa Given por más de 25%, proporcionando ayuda a 12,572 familias de Los Ángeles con fondos para darle de comer a sus familias. Además, hoy, gracias a una donación muy generosa de $5 millones de Willow Bay y Bob Iger, 1,000 empresas de nuestra ciudad que han sido más afectadas por COVID-19 saldrán de la lista de espera y recibirán ayuda y tendrán un futuro más prometedor. No importa quién es o cuánto puede dar, necesitamos su ayuda también. Si usted es un angelino con unos pocos dólares, por favor, visite mayorsfundla.org. Y gracias. Si es un angelino que está sufriendo dificultades económicas, la ayuda está en camino. Pero hay esperanza en el horizonte. El cambio vendrá. Y pronto avanzaremos juntos hacia una realidad mejor y más segura. Por ahora continúen haciendo sacrificios. Quédense protegidos, quédense en buena salud y quédense en casa. Fuerza y amor, Los Ángeles.